Good morning. Now we are going to see about the drugs used into the hypertension. So this is the classification of the different drugs used into the hypertension, like diuretics, which is thiazide, like hydrochlorothiazide, high ceiling fusimide, and potassium spirin, spironolactone. Next is AC inhibitor, that is the captopril type of the drug, AT1 receptor blocker, losartan, direct renin inhibitor, elisquin, calcium channel blocker, verapamil and diltiazem, alpha adrenergic blocker, propanolol, alpha fast beta adrenergic blocker, labetalol, alpha adrenergic blocker, that is the prazosin, central sympatholytic, clonidine, vasodilator, like hydralazine, arterials and venous acting, that is the sodium nitroprusside. So now we are going to discuss about the some of the drugs used into the hypertension. What is their mechanism of action of those drugs and how they are produce their effect. Now before that, first we need to understand that Angiotensinogen is the plasma alpha 2 globulin. Now what will happen whenever there is a low macular dense of sodium or chloride, low glomerular afferent pressure, enhanced sympathetic activity due to NaCl loss, fall of blood pressure, fall of blood volume and the renal ischemia, just a glomerular cell of the kidney, it will release the renin. In presence of the renin, angiotensin 2, it will convert into the angiotensin 1 in presence of angiotensin converting enzyme. Next, in angiotensin converting enzyme in presence of AC, it will converting into the angiotensin 2. Then aminopeptides in presence of aminopeptides, angiotensin 2, it will convert into the angiotensin 3 and then angiotensin 4. Now, angiotensin 2 is responsible for vasoconstriction. Now, vasoconstriction means peripheral vascular resistance, it will increase, blood pressure, it will be increased. Next is sodium and water retention. If there is a sodium and water retention, blood volume, it will be increased, so that blood pressure, it will be increased. Next is angiotensin 3 and angiotensin 2 also responsible for the aldosterone secretion. Aldosterone secretion, again, it will cause the sodium and water retention. In turn, it will increase the blood pressure. Now, this is inhibition means in the normal condition, negative feedback mechanism. When the blood pressure is increased, body is directing the juxtaglomerular cell to reduce the renin. Now, in case of the blood pressure, what are the different drugs used into the particular system? Now, angiotensin in presence of the renin, it will convert into the angiotensin, what we have seen. Angiotensin 1, it will converting into the angiotensin 2 in presence of angiotensin converting enzyme. Now, ACE inhibitor or angiotensin converting enzyme inhibitor like captopril, they will inhibiting this enzyme. As a result, there will be no production of the angiotensin 2 or the further angiotensin 3. Now, angiotensin 2 and 3 is responsible for the increase into the blood pressure. So, by inhibiting the angiotensin converting enzyme, these drugs inhibit the formation of the angiotensin 2, thus it will reduce the blood pressure. Angiotensin 2, whatever we have seen, is various effect, which is mainly mediated through the angiotensin 1 receptor, AT1 receptor. Now, AT1 receptor, angiotensin receptor blocker, that means AT1 receptor blocker. So, these drugs, it will block this receptor so that angiotensin cannot act on the angiotensin 1 receptor. As a result, this function like vasoconstriction, sympathetic activation, cell proliferation, aldosterone release, renal sodium reabsorption, all these things, it will be you can say that stop. As a result, blood pressure again, it will fall down. Other category of the drug like renin inhibitor. Now, renin inhibitor directly it is inhibiting the renin. Clear? Directly it is inhibiting the renin, which is secreting from the juxtaglomerular cell. Now, if the renin is inhibiting, there is no conversion of the angiotensin 1 and further to angiotensin 2 and 3. So, there will be no rise into the blood pressure. Blood pressure, it will be decreased. So, this is the mechanism of this three category of the drug: AC inhibitor, AT1 receptor blocker, and renin inhibitor, how they are going to affect and reduce the blood pressure. Next category of the drug is the clonidine. Now, clonidine, it is act on the alpha 2 receptor. Now alpha 2. Now this alpha 2 receptor, if you remember that noradrenaline, whenever it is released from the neuron, it will act on the alpha 1, alpha 2, beta 1, beta 2 and beta 2 receptor which is present into the post-junctional site. But pre-neuronal area or post presynaptic neurons, there is a presence of the alpha 2 receptor. Alpha 2 receptor, what for it is important? It is to the negative feedback mechanism. That means any when it will act on the alpha 2, it will reduce the release of the any from the sympathetic nerve. Now, clonidine, it is act on the alpha 2 as the agonist. Clear? It is act on the alpha 2 as the agonist where in the you can say that in the central, so that what will happen, it will reduce the noradrenaline outflow, and we know that in activation of the central alpha 2 receptor as we have told, it will cause the decrease of firing of the sympathetic nerve plus sympathetic nerve. Whenever they are decreasing to the sympathetic nerve, so what will happen, they will act on the SA node, of course into the again the ventricles and all, so that heart rate, impulses and the venous return, all those things it will be decreasing. It will cause the vasodilation, vasoconstriction it will not there, again the blood pressure it will be decreased. So this is the mechanism, central mechanism of the clonidine. Next, coming to the alpha action and beta action. Now, beta adrenergic blocker, what are the defined category of the drug used into the treatment of the hypertension? Beta adrenergic blocker, alpha beta adrenergic blocker and alpha adrenergic blocker. Last one is the alpha adrenergic blocker. Now, first we'll come to the alpha adrenergic blocker. So it is peripheral, acting peripheral. Now, we know that constriction of the arterioles and vein, if we are looking into the first point, it is responsible to the alpha and beta, alpha 1 and alpha 2, and as a result blood pressure it will increase. So if we give the alpha blocker, alpha blocker, that means there is no constriction of the arterioles and the veins, as a result blood pressure it will come down. Clear? Blood pressure it will come down. So this is the alpha adrenergic blocker like prazosin, how they are going there. Now beta blocker, now we need to understand there is a beta 2. Beta 2 is responsible for the dilation of the arterioles and vein and fall into the blood pressure. But beta 1 responsible for the renin release in kidney, and already we have seen release of the renin from the kidney, it will increase into the blood pressure. In the previous slide we have seen. Now alpha adrenergic blocker, there is a two category of the drug is there. One is the selective beta 1 blocker like atenolol. Now selective beta 1 means they will only act on the beta 1, so they will inhibit the renin release and blood pressure it will drop like atenolol. But non-selective like propranolol act on the beta 1, fine, renin, if they are acting on the beta 1, renin release it will be inhibited, blood pressure it will come down. But if they are acting on the beta 2, blood pressure should go up. But if we are comparing these two, effect of propranolol on these two, this effect is more prominent, this effect is not that much prominent. As a result, of course through some mechanism blood pressure may increase, but through the major mechanism blood pressure will go down, so that ultimately blood pressure is go down for the propranolol. Next is alpha plus beta blocker. Alpha plus beta blocker like labetalol. Labetalol, one of the drugs already we have discussed, they inhibiting the alpha and beta, as a result blood pressure will go down. So these are the some of the drugs we have discussed, their mechanism of action, how the blood pressure will comes down after the use of these drugs.